I just like what I do, and I think the time goes by fast. I don't realize I've been here for 10 years. I've had the opportunity to work with really great people who've mentored me, who've taken me under their wing, and to me that was rewarding, being able to work with communities of color and being able to provide them with some assistance to make them become their own advocates.
I think it's a job that also lets me walk my talk. I've been an athlete all my life, and I really wanted to get into chronic disease prevention because I believe very strongly in what it represents, and that's why I do what I do.
A lot of the work that we do here is about relationships and partnering up, and not only at the grassroots level with community residents, but also with our partners at different agencies, and even across our own department with our own programs.
Healthcare, is more focused on individuals and changing their behaviors, whereas I think in public health we focus on our larger systems. When I think of the accreditation process, I think of accountability, holding ourselves accountable to the people who rely on us to provide programs and services, and for that I think it's really important.
It's going to give us more credibility to funders, to our elected officials, to our community, so I'm personally looking forward to doing this.
Others would be looking to us as a model and saying to themselves, well, what are they doing right? Can we model ourselves after them and achieve kind of the same successes that they've had by following their standards and their practices?
I think it's important to always check in to see what were our lessons learned from this particular project. We tend to do that a lot in our unit, to always regroup and talk about what worked and what didn't work, and for what we can change for the future.
Quality of data is extremely important, because that's what people use to know that they're actually improving health in the community, is they have the data to go by to say, okay, we know we're moving the needle on physical activity or nutrition or other areas because we're seeing an improvement here in the health of our community.